You're dealing with a persistent ache on your right side, recurring nausea, and digestion that feels heavy and slow. You know your body well enough to recognize that these aren't just random occurrences. You go to the doctor for answers. They run the standard diagnostic battery, a liver function test, and an abdominal ultrasound to check for stones or inflammation. When the results come back, the feedback is often the same. The numbers are within range, the imaging is clear, and you're told everything is fine. But that clinical reassurance doesn't change the fact that you still feel unwell. This gap between your symptoms and a normal report often stems from how standard blood panels are categorized. There is a specific enzyme that is rarely prioritized unless it hits a critical high alert threshold. That marker is Gamma-Glutamyl Transferase, or GGT. In most clinical settings, GGT is used as a specific filter to identify heavy alcohol consumption. If liver enzymes are elevated, GGT helps determine if alcohol-induced toxicity is the primary cause. Because of this specific diagnostic use, a GGT result for a non-drinker is often viewed as a secondary detail. If you don't consume alcohol, an elevated but in-range number is frequently categorized as statistically insignificant. However, relying strictly on those broad reference ranges can prevent you from seeing a measurable shift in your internal chemistry before it progresses into a diagnosable disease. On a standard lab report, the reference range for GGT is surprisingly wide. It typically spans from 0 all the way up to 60 units per liter. This chart represents the clinical standard. This 60-point range is designed to catch acute pathology, severe issues like liver failure or chronic toxicity. It is a tool for identifying a crisis, not for measuring efficiency. For the liver and gallbladder to function with high efficiency, the physiological requirement is much narrower. Optimal biliary flow is generally associated with a GGT level below 30. When the GGT for a non-drinker moves into that 30 to 60 range, it serves as an early indicator of a change in your biliary system. A score in the mid-40s suggests that the drainage system is experiencing mechanical friction. The chemistry of your bile is beginning to shift. This shift is known as cholestasis. It's the process where bile, the fluid responsible for breaking down fats, becomes thick, sticky, and slow-moving. Think of your biliary ducts like the plumbing in your home. An elevated GGT suggests that the fluid is becoming more like sludge than water. The pipes aren't blocked yet, but the flow is becoming increasingly restricted. Accepting a 45 as normal means dismissing a measurable decline in your drainage efficiency. It allows this sludge to continue thickening toward the point where surgical intervention eventually becomes the only remaining option. When you present with right-side discomfort, the standard follow-up is an abdominal ultrasound. This imaging is the gold standard for finding one specific thing: hard, fully formed gallstones. Ultrasound physics rely on reflection. Sound waves bounce off dense stones to create clear images. But with soft, viscous GGT sludge, sound waves pass right through. The result is a clean image, even though the gallbladder struggles. This creates a significant diagnostic trade-off. You may receive a negative ultrasound report while symptoms persist, creating a sense of confusion about how to proceed. The risk of relying solely on imaging is that by the time an ultrasound can actually see a problem, the sludge has already hardened into stones that often require surgery. Monitoring GGT provides a way to identify the presence of this invisible sludge while it is still in a state that can be thinned and cleared. If your GGT is climbing, you can choose a proactive path. This 3-step dietary strategy is designed to improve the chemistry of your bile and clear the ducts before stones can form. Step 1 focuses on supplying the liver with specific raw materials required to thin thickened bile. The primary tool for this is choline. It acts as a biological emulsifier, helping break down fats and restore the liquid state of the bile. The trade-off here is dietary consistency. Choline is found in egg yolks and soy lecithin. Incorporating enough of these into your daily routine, especially if you follow a vegan or low-cholesterol diet, requires careful planning and tracking. Step 2 is about drainage, physically moving that thinned bile out of the liver and gallbladder. This requires 2 specific compounds, taurine and vitamin B6. These are essential for the mechanical contraction and flow that prevents bile from stagnating. The trade-off for Step 2 involves specific nutritional sourcing. Taurine is mostly found in animal products. Those on a plant-based diet will need to focus on precursors like mung beans or use supplements to maintain this drainage mechanism. Improving drainage isn't a one-time event. It requires a daily nutritional commitment to maintain the flow of the system. Step 3 involves softening the existing buildup and ensuring it is safely removed from the body. The key input for softening biliary sludge is malic acid. You can find high concentrations of this in green apples. Malic acid helps to gradually dissolve the bonds in thickened bile, making it easier for the system to flush it out. The final component is a binder. Consuming a soluble fiber like psyllium husk at night allows the fiber to trap the excreted bile in the digestive tract, preventing it from being reabsorbed and ensuring it is removed. There is a practical trade-off. Fiber requires a significant increase in water intake. If you don't scale up slowly and stay hydrated, it can lead to bloating or discomfort. While this protocol requires significant daily effort and dietary changes, it provides a specific biological pathway to improve biliary drainage and slow the development of gallstones. Your choice depends on where you fall on the spectrum of health. You can stick to the broad clinical standards, or you can adjust your habits to reach a physiological optimal. Map this out. GGT 30 to 60 with active symptoms needs the full protocol for immediate support. GGT above 30 without symptoms requires preventative habits like a daily green apple. GGT below 30 without symptoms means efficiency. Monitor annually. A lab report provides the data, but it's up to you to interpret that data in the context of your own health. Optimization is about managing your internal drainage today, rather than waiting for an out-of-range report to signal a surgical emergency.